Great. Thank you, Taylor, and thank you all for being here. We appreciate the opportunity to fill you in on a few activities that have been happening over the last 12 hours. My name is Chris Crotterville, and I serve as one of the executive directors of the Global Center for Health Security at UNMC and Nebraska Medicine. And as many of you know, there was a joint mission over this last evening between ASPR, the Assistant Secretary for Preparedness Response, the CDC, and State Department to bring 2 airplanes with American citizens back to the U.S. There was one plane that landed at Lackland Air Base with 151, plane that came to Travis Air Base with 177 individuals. Over the last few days, we had been preparing for the potential opportunity to bring back U.S. citizens here in support of that mission. Late last night, at about 2 or 3 this morning, we were asked to bring some individuals here, individuals who had either tested positive or had a high likelihood of testing positive because of symptoms they were exhibiting. These individuals were brought here because we have the personnel, we have the facilities, we have the resources and the expertise to handle these kind of individuals. So this morning we did have 13 individuals who arrived on the 2 planes. They were transported here to the medical center where they were being assessed and cared for. Comments?
You want to talk about our
Yeah, my name's Mike Wadman. I'm an emergency physician and co-medical director of the quarantine unit. And I was a part of the team that boarded the planes, did the initial assessment of the patients arriving from Japan. And at that time, everyone appeared to have arrived comfortably. One patient was transported to the hospital, to the biocontainment unit, because of a chronic condition, and also was experiencing some mild symptoms, feeling lightheaded, and was having a little bit of shortness of breath at the time. So was transported to the hospital for further evaluation and observation. Remainder of the patients were transported to the quarantine unit.
So I'm Shelley Sweethelm, and I'm a nurse, and I'm the Executive Director of Emergency Management, and then have clinical oversight of the quarantine unit and the biocontainment unit. And I think what I would say is that we have practiced and trained for this. We actually train others across the U.S. and internationally to do clinical care as well as infection prevention and control techniques to keep ourselves safe and the individuals safe. So the folks that are over in the quarantine center have all been now tested, and so we're waiting for those results. We just felt like that was a great idea because I think we just weren't clear, about all the information. So they're all in separate rooms that have engineering controls, and we're just kind of working through getting to know them a little bit more and learning about them and their families, and working through some communication things to get them connected up back with their families here in the U.S. So then we have the one person that Dr. Wadman talked about that was taken to the biocontainment unit, and he is doing good and is in stable condition at this time.
And as Shelley mentioned, this really is building upon expertise that we've been developing for a decade and a half now. With the biocontainment unit being launched 15 years ago, since that time, we've continued to develop expertise, develop the skills, and do exercises to prepare for times like this. With our federal quarantine center, which recently opened in the Davis Global Center, we now have 20 purpose-built rooms built in collaboration with the federal government in a public-private partnership to prepare for a quarantine mission just like this. So when we received the notification early this morning requesting that we assist the Assistant Secretary for Preparedness Response, the State Department, CDC, we were ready, willing, and able to step up and take that on. Happy to take questions.
So you said that you got a call at 2 o'clock in the morning about bringing them here. Did you guys get a heads up beforehand about that you guys might be getting this call? Because we found out that there was a test positive on the cruise ship over the weekend. Were you shocked that you got a 2 a.m. call, or was it?
Yeah, so we were very much prepared because we had been in conversations with the Office of the Assistant Secretary for Preparedness Response. We knew that they had a mission that they were bringing individuals back, and we knew that if there were individuals who ended up testing positive or becoming symptomatic, that they may request our services to support that mission.
So the call at 2 a.m. wasn't?
Not a surprise.
Who'd the call come from?
It came from the Office of the Assistant Secretary for Preparedness Response.
You say you've got 20 rooms there, but as I recall, the biocontainment unit has, what, 3 rooms or 4? What happens if, God forbid, there's more of an outbreak than you can handle?
Yes, so we've planned for that as well. So if we have individuals who would become to the point that they need hospital admission, which, you know, I think what we've seen so far with this virus is that's a pretty low percentage. There's a lot we don't know about the virus yet as it's, you know, fairly new. But each of the rooms in the biocontainment unit, there are 5, and they're dual-purpose rooms, so we could accommodate 2 patients per room. And then we also have a surge location. It actually was used as temporary quarantine rooms back in 2015 when we had our individual from the Democratic Republic of the Congo, so before the new Global Center opened. So we do have a surge location as well.
And kind of getting back to the 2 a.m. call, right after that happened, how did that coordinate with local law enforcement? Were they given the heads up before that 2 a.m. call, or was that?
So, yeah.
Oh, please go ahead.
So yesterday we had a transport briefing just because we wanted them to all be aware that we'd been sort of put on standby. And then we again, during the night after receiving the call, contacted each of those folks again and convened and talked about how the logistics would work.
So they were well aware that these planes were coming in?
Well, I think as soon as a flight plan is, you know, kind of filed, that becomes pretty clear information. So, yeah.
One of the tremendous benefits that we have as a state and as a community is that we do work very closely together. So as we started having those early conversations, we did have conversations with the governor's office, with the mayor's office, with a variety of state and local agencies. And by having that shared information, everyone being on the same page, we're able to quickly then respond when we were asked this early this morning to be able to move forward and accept these individuals.
Can you walk me through what are the symptoms of the one in the biocontainment unit as opposed to the one that are in the quarantine center?
Well, the patient that was transported to the biocontainment unit had some lightheadedness, had a mild cough, had a fever that was documented before landing, and also had a chronic condition which, you know, could complicate the issue if he were to test positive for coronavirus. And so as a precautionary measure, he was transported to the biocontainment unit for testing and also for observation to make sure his condition was stable and not deteriorating.
And the ones in the quarantine units, are all those pretty similar?
No, they're asymptomatic.
Okay. No fevers?
Yeah, none, no.
Yeah, I don't
But
think we.
because they were near this other guy, or?
Well, I mean, they're being transported here because of the testing that occurred at the point before departure in Japan, and so we're deemed to be higher risk and transported here for our level of expertise.
Have
That's-
all 13 then tested positive? Because it wasn't clear from Dr. Robert Cadlick was on the federal call.
Yeah.
He said 10 passengers and spouses, so it's a little
Yeah,
unclear.
it is very unclear. And so I think anything prior to this, like we've got no documented information, it's all been verbal. And so that's why we're going through and doing the additional testing of everyone at this time.
Are there spouses involved in this?
Yeah.
And all of these 13 have tested positive?
No, we do not know that for sure.
How many have tested positive?
We don't really know that for sure either. We believe around 10, but we don't know.
So
And I
what
think-
you guys are doing, you start from scratch?
Yeah, so absolutely. So what we're able to do is, because we do have a CDC-approved test, so we can very rapidly assess the individuals, we can conduct the test, and similar to the individual who came from Camp Ashland the other day, who had some symptoms, they came to campus, we did the test, it was repeated negative, and they were able to go back. We're using that same test on these individuals, and one of the benefits we have of having this infrastructure here on campus is we have the expertise in a multitude of domains. So we have the infectious disease experts who can do the assessments of the individuals. We have the experts who can do the laboratory examination. We have the experts that can care for the patients or the individuals in quarantine. And by bringing those all together, we're doing a thorough assessment of the individual. We'll soon have the results of the folks who landed here earlier this morning. But because it was a fairly quick turnaround between their arrival and our press conference, we don't have all those results.
Does that slow you down any because you had to do all this testing, or did you have to do that anyway?
Oh, we would have done this anyway. So clearly these were folks that had a high index of suspicion that came to us. And so all of them, we knew that we would evaluate them, but we're not handling them any differently. We have an abundance of caution in how we're managing them as we're getting them settled in. And then that will guide how we manage them in the future based on the testing results.
Looking at the patient in the biocontainment unit versus those who are in quarantine right now, and I'm speaking specifically about the patient in the bio unit, is that quarantine process for that patient going to take longer than what the other 12, I think, are going to have to go through?
I think it would depend on the results of testing and also his response to what they're doing for him therapeutically. There's too many variables to really make a prediction on that.
So
Yeah.
to be clear, the man that's in the biocontainment unit right now, he has not tested positive for coronavirus yet. He's just in the biocontainment.
Our testing is
Yeah,
not
we haven't done
available
it
yet. All of these individuals, regardless of whether they test positive or negative on the test conducted today, will be here for 14 days. Those that test positive and are ill could theoretically be here longer than 14 days, but each of the individuals who arrived today will be here for 14 days.
How much different is the test from what you guys are doing to what they've already been doing overseas?
I don't think we know that for sure.
How come there's kind of a discrepancy on how many numbers of who might be infected?
Well, there's been no documentation that came with them, so everything has been sort of passed along, and they've had a very long journey. So I think we're not going to make any assumptions about anything that's passed along verbally. We're going to go ahead and just test everybody.
Was it the Japanese that were doing the test then?
Yes.
And is that, okay.
Were these 13 people just chosen at random to come here, or were they higher risk, lower risk? Was there any particular reason why Omaha as opposed to some other location?
Yeah, what we were informed is these are individuals who may be a higher potential risk. And because we did have the purpose-built facility that was developed and built in partnership with the Assistant Secretary for Preparedness Response, we really had an ideal venue for these individuals to come here for their observation and care if needed.
Do you anticipate more people coming?
We certainly stand at the ready. We don't know if there will be more, but as the individuals are assessed at the other air bases, it's certainly possible that some could test positive and we could be asked to take more. And we'll have discussions at that point to decide if we have the capacity depending on the numbers they might need.
Will these individuals spend the 14 days at the quarantine center and just stay there rather than, if they're fine going to Camp Ashland?
Yeah, the individuals here would stay in the quarantine unit for the 14 days unless they developed symptoms or, other concerning signs. And at that point, we would have to reassess.
When are you guys going to have a clear picture in terms of test results and all that?
A few hours, I think. Usually 4 to 6 hours is our window, so I know it's been started.
Can you walk me through the super long flights, then they go to California and then Texas and then to Omaha? What was maybe the spirit of these folks knowing that they had another couple weeks in the building?
Yeah, they were very, tired after the long travel, but their spirits were high. They were very grateful. Once they got on the buses and they're on their way here, we're talking with each other and with us, and we're very, I think, very upbeat and glad to be here.
I would say a sense of relief. I think they were relieved to be here. I think they felt comfortable. They saw, our teams arrive, and I think we were Nebraska nice and friendly, but also we were confident we could care for them. And so just in the brief conversations in the van ride from the airport to the campus, we're able to fill them in a bit, and they seemed comfortable and ready to hunker down for a couple of weeks and relax and get some sleep.
Are they all children? Any children?
These are all
No,
adults.
no children.
What are the facilities like? Is it like dorm rooms? Is there a common area where they can go and mingle with each other? Are they gonna be
Yeah.
just locked in the room? What's it like in there?
So they're very nice rooms. They have engineering controls, as we've talked about. They have Wi-Fi, they have TV, they've got a small refrigerator. You know, just a lot of the amenities you would have if you were going to a hotel with a lot of engineering controls. For the short term, they're all going to be kept in their room because we're isolating them until we know the testing results and things like that. And then we'll still have to decide, based upon the mix of folks that we have, whether or not they'll have to stay in their room or if they could actually, you know, I don't know, walk the hall or whatever. Those things will have to come after we understand a little bit more about what we're,
Are spouses
Situation.
separated as well, or are they together?
they're separate.
2 tests again, Shelley? Because you did
Um,
better with the other folks?
I don't know that we know that. I think we're going to do the CDC test.
Yeah, so I
assay,
think
but-
this is a little bit different because these aren't people that we would test once, repeat in 24 hours, and then send home. So regardless of their clinical course, we'll keep them here for 14 days. So we will get that initial test. Whether it's positive or negative, we will maintain them here on campus for 14 days. And I think as we have our internal discussions, which are still very nascent since we just had the call this morning, we'll discuss internally really what will be the best practice as far as frequency of testing.
In regard to the symptoms you're seeing in comparison to the individuals at Camp Ashland, are these symptoms more severe that you're seeing right now? I know it's still preliminary information you have, but compared to the people at Camp Ashland.
Yeah, I mean, the patient we saw from Camp Ashland had a very mild cough, and the patient that we've admitted to the biocontainment unit had, more lightheadedness and was much more, prominent symptoms, but not to the degree that, that would be impairing him in any way. He was able to converse in a normal voice, was able to stand under his own power. But because of his chronic condition and because of those symptoms, we want to take precautionary measures to make sure he's getting the evaluation that he needs to evaluate what is causing the symptoms.
He is not tested positive, correct?
Yeah, at this
No
point, that's my
testing is
understanding.
back here right now, so we've got no test results this time.
I think he's referring to Ashland.
Ashland.
If you're referring to the patient from Camp Ashland,
Yeah, we,
no result at this
Yeah,
point.
we have no results yet from our lab here. That all the samples have been collected, they're being run by the lab, and really shortly after this press conference, we should have those results available.
But I take it not all 13 have tested positive over there either.
I think that's correct. I think there's a few that weren't tested at all, but I think that's why we're just starting from scratch. We want to know what's what.
What makes them the higher risk then? I think those are the words you use. But
Yeah.
you don't really have any data to support it. What does
Yeah.
it tell you that then clicks
So
that
what my
box?
understanding is, some of the folks did test positive with the tests in Japan. Some of the folks did have fever, and some of the folks did have cough. So and what happened is, as they were leaving Japan, when they were initially making the decision to send the American citizens back here, none of them at that point were symptomatic, and none of them had positive tests. So that's how they started the process. And I think part of what makes it a bit confusing is some of those positive test results came during the process of transport. And the symptoms that did develop were in the process of transport. So that's why, as they landed at the 2 Air Force bases, at that point they had to really reassess who were the individuals who had a positive test, which results came during the transit, who are the individuals that developed symptoms during the transit, and that's how they got allocated us. So I think right now, as we're speaking, our clinicians are sorting through those symptoms, that history.
Have any of these people told you that they have tested positive for it elsewhere?
Yes. Yeah,
But you just want to clarify with your own.
right.
So little is known about this virus, or how it's transmitted. I read where in China they're washing the money and disposing of money, and that it can possibly travel through pipes and that. Are you confident that 2 weeks is enough time to be in quarantine, or are there concerns about, this virus traveling in ways that you might not have suspected?
I think we're becoming more confident in how the virus is transmitted. I think, the 14 days is for someone who has had a high-risk exposure but has not got, a confirmatory test. For those that have a confirmatory test, we very well may have a longer length of stay, because I think there'll probably be some testing and retesting, before they're allowed to be discharged. So those things will really rely on the CDC to provide the guidance on.
Did we get all the people who tested positive or are seen as at risk, or were some left off?
Yeah, I don't know that.
Travis and Lackland?
I don't think we're clear exactly if there were some who tested positive that remained or some that were symptomatic that remained. It really was a decision that was made at those two air bases, and then when they arrived here, that's really when we identified who would be coming to the medical center.
I understand you also had someone on the ground, a doctor from here who was in Japan helping to evaluate, is that correct? Helping to evaluate these patients along with somebody from Mass Gen and,
Yeah.
okay, just making sure I heard that right on the federal call.
Yes, and we did just talk with him. He said it was fine. Yeah.
Yeah.
Dr. James Lawler,
Okay.
he did just say it was fine, so.
Yeah, so he's an infectious disease physician who has been working closely with us with our Global Center for Health Security, and he was asked to go out to Japan to help to do some evaluation on the cruise ship, and then he and the other physician from MGH were on the 2 flights coming to the U.S.
What's the chronic condition that the guy has?
I don't think we're interested in talking about,
Why not?
because that's just their own
We
privacy.
don't have any name or anything. How can
Yeah.
that be
It's
private?
just a chronic illness. It's not an uncommon chronic illness. It's just something that I think caused concern.
Why the secrecy on that?
Well, patient privacy, it's just really,
Well, when somebody gets hurt in a car wreck, they say he has a concussion and we took him to Nebraska Medical Center. There's no patient privacy.
Authorities say that, right? That doesn't come from the hospital. It's got a consent from the patient, that doesn't come from the hospital.
How is transportation handled differently with this group compared to the group from 10 days ago?
I think the group from 10 days ago received screening at the airport. They were taken off and received the screening there. Difference here was and actually was in a hangar at the airport. We did screening with the smaller group on the airplane before they came down onto the tarmac and were boarded onto the buses and brought here. Other than that, most of the process was very similar.
Including the land transportation was pretty much the same?
Yeah, we used
Used
smaller
yeah,
vehicles because there were
smaller
smaller
group.
numbers.
Did any of them talk about their experience on the stuff on the cruise ship?
They did, yeah.
What did they say?
They said the food was good.
The food, yeah, the food was good. They pretty much were isolated in their cabins, and the ones that had the inside cabins, had not been outside for a long time, so they were very glad to be out in the open air.
Yeah.
They said it was a little cold here, but they were very glad to be outside. But really very positive and upbeat, despite having been in pretty difficult conditions for a period of time.
Can you speak to when they were making their way back to the States, on those airplanes? Walk us through what the protocol is to have them in that isolated containment, I guess was the
Yeah.
explanation, because, there's the body within the airplane, but how do you separate these particular individuals from the rest of the
Yeah, I don't think
I
we
think
know.
I think that'd be a question for the transport services. We boarded the plane and stayed at that portion of the aircraft, and we're not in the other parts of the aircraft.
So you had mentioned that you have the 5 dual rooms
Mhm.
at the bio unit, and then you said something about kind of an overflow room?
Yeah, it's an
So what's-
overflow unit with several rooms.
So how many could you theoretically, if another plane came in, you have
Yeah,
20 over there, you have 10 here, and then
Yeah,
20 more?
so we always need to think about, if somebody gets sick, then how do we accommodate that? So the quarantine unit is really for folks that are outpatient, need to be tested, don't have enough symptoms to really require an inpatient admission. So we just always want to make sure we've got capacity to be able to accommodate that. So in addition to the biocontainment unit, we have another unit that is what we call our surge location. So that would have, you know, an additional several rooms that we could utilize if we needed to.
One of the critical conversations we always have is not only how we can obviously extend out and you know, help support U.S. citizens across the globe, but also how do we stand prepared to help within our local community and state as well. So as we had talked with local public health individuals, we did talk about where would we put individuals if there were individuals in our community who came in and got sick, because we obviously have to care for our own as well here in our own community. And we also have the folks out at Camp Ashland. So if some of those became symptomatic, we need to be able to handle that capacity as well.
Right, and I think in terms of the preparation of our healthcare providers and, you know, the personal protective equipment, all the processes that we need to be experienced in, that this is excellent preparation for that.
Some people are gonna see headlines of this and now worry that obviously this virus, if somebody does test positive, is within miles of them. So how can you reassure the public that they are still safe, even though obviously there could be someone with the coronavirus here?
Yeah, so I think like I mentioned, you know, until we're done with testing, they'll be self-isolated to their room. So their room has engineering controls to have separate HEPA filtration and all the things that would make that room very safe and make every other space in that building safe. So there's just a lot of comfort, I think, in having that sort of a facility. And then, of course, all of the healthcare workers involved in this mission are very skilled. And we practice and train and teach on these topics related to infection prevention and control. So we have a lot of confidence in our people and our team.
Well, we're fortunate in Nebraska because we have the staff, the facilities, and the expertise, and that's why the federal government is really placing their confidence in us. And I think as we've moved forward with the Davis Global Center and we have discussions about potential other opportunities in the future, I think we're seen as a trusted partner with the federal government, and we continue to validate that.
Previously, you've had the federal officials ask for CDC folks were taking care of any patient, had any contact knowledge for patients at Camp Ashland, and then also initially when the balloon was brought from Camp Ashland, it was CDC asked for folks who were taking care of her. So this time it will be Nebraska Medicine staff who will be taking care of these folks.
It's still a federal quarantine, federal isolation umbrella.
Okay.
But given this is our unit and we're accountable for the National Quarantine Unit, we'll have a much more active role in supporting the individuals in that.
But it really is a public-private partnership. It's bringing in those federal agencies and the CDC with the quarantine isolation order and partnering with our resources and expertise to help execute.
So it'll be a mix, more of a mix this time.
Yes.
When this first became, people became aware of this, they was told, oh, you know, so many people die every year of the flu. This is, you know, just really like a bad case of the flu. It's, you know, that was being compared. Now we know more about the virus. Are you more concerned about it than other than just being, you know, a really bad case of the flu?
I think it still really behaves a lot like the flu. I think the difference is that, you know, it'll be a while before we have a vaccine. So I think that's why it's really important for all of us to be mindful and be prepared for care and the needs that we may have here should that become an issue here in our country.
Any indication that this can mutate like a flu virus can?
I think
It's
that's
early yet, and
anybody's
there's
guess.
a lot of unknowns.
Yeah, there's a lot of people looking at it though, for sure, to better understand what it is and how it's behaving.
Are there team members right now who are going to be involved in this process who can draw on their experience from when, you know, UNMC bringing those Ebola patients years ago?
Yeah, very much so.
Have they mentioned anything to you about drawing comparisons to just putting the plans in action?
I think overall, you know, our team training and everything is pretty much the same. Even our personal protective equipment is very similar. There's just a few nuances with a respiratory pathogen versus a contact or viral hemorrhagic fever type pathogen. So I think they're just drawing on all of that, but we train for all of that, so it isn't anything that's unique or different to us than what we've trained for.
And really, that foundation that Dr. Phil Smith put together with the Biocontainment Unit 15 years ago is a foundation we've continued to build upon. And every quarter, we're doing exercises and training, and, you know, it really is an ongoing iterative process. And so it really is built on that foundation, and we continue to move forward in that way.
Is this costing the hospital any extra dollars, putting so much more staff and obviously just focusing on this particular unit and all that?
So we actually have a contract with the Assistant Secretary for Preparedness Response for quarantine service. So that, we have an underlying contract that helps to support that care and helps support our readiness. So that really is a part of that collaborative partnership.
So like tax dollars aren't necessarily being used on this?
This is really,
Nebraska State University.
this is really supported by the federal government.
More questions?
I'd like to come back to chronic condition. Given that people might be alarmed at a lack of information, should they be alarmed by this chronic condition?
I think anytime you have a chronic condition and have an infection at the same time, that it can be more concerning and require more evaluation and observation time, and that's not different than any other infection.
Nothing special about this chronic condition?
No.
Yeah, I think the anecdotal reports that we see are that the elderly that have chronic conditions, like imagine cardiac disease or pre-existing lung disease and things like that, then if you get that infection superimposed on that, that makes you more at risk for sequelae.
Similar to influenza.
Right.
So we have 13 people in this unit total today? Is that good?
We have 12 in the quarantine unit and 1 in the biocontainment unit.
Any of them from Omaha?
I don't think so.
Yeah.
They didn't remark like,
Mm-mm.
nice to be back home.
No, there's
No.
some that had been here before visiting, but none that were
And some
residents.
not.
Yeah, many not.
Yeah.
Just real quick, any families in this group?
No families, but there's some couples.
Okay, thanks, folks.
Thank
Appreciate it.
you.
If you have
Thank
any
you
more
all.
questions,